I'm back in Brooklyn right now. I've been to Brooklyn more in the past 44 days than I have maybe in the past 44 years. But I'm here today for a couple reasons. I don't know if people have been watching Andrew Cuomo's truly ridiculous press conferences. There's been a lot of press conferences. I know it's hard to keep up. Now, we're pretty close to where I was the other day, the Greenwoods Cemetery. It's the largest cemetery in New York City as far as I know. So there's actually, I guess, a lot of funeral homes around here. This is the Ortiz Funeral Home. Wasn't aware that that was here. There's a sign on the door. It says, if you're seeking to take a funeral arrangement, please contact the number below. Okay. So, I mean, you know, maybe they're really busy. There was an article that was sent to me. I just want to check if we're live. I never know. I come to these neighborhoods I'm not familiar with. I don't know if the network is strong or not strong. Yeah, it looks like we're live, so that's good. We'll check comments in a little bit, but let's just take a look. So here at the Ortiz Funeral Home, I don't want to, intrude on anything that anybody's doing, but it looks like this entire brick building would be the funeral home. And, from what people have been sending me from the international news, I would expect a lineup of trucks here. Certainly, it's late in the day. I wanted to get here earlier, but some of these places are open 24 hours. This looks like a loading dock here, possibly for the Ortiz Funeral Home. Maybe, who knows, maybe this brick building is part of the same building. Maybe members of the family live there. I don't know. Maybe it's just this part in the front. I don't know too much about the Ortiz Funeral Home. I hope everything is working all right. You know, the subways are going so slow. I had to take 3 different trains to get here, and I had to wait more than a half an hour in between each one. So let's talk for a moment about Andrew Cuomo. As I walk down the street here in Brooklyn, we could call the Ortiz Funeral Home, but I think people are seeing it doesn't look like a tremendous amount of activity around it or in front of it. Granted, it's 5 o'clock, so perhaps they're done for the day. I would think if you're having, a global pandemic sufficient to strike fear into the hearts of people across the Atlantic Ocean and around the world, you might be working a little late. People will recall that the president of Greenwood Cemetery told me that they were closed on that Saturday. It was a union holiday. Again, I would think if, a lot of people are hearing in the news that it sounds like there's like dead bodies flowing in the street in New York City, that you think these places will be working overtime and double time. So I had received an email from a friend of ours in Norway. A lot of people know Charles and I went to Norway, so we're in touch with some people there. And this article here, this was from some Norwegian website I'm not directly familiar with. We could just translate it to English. But it's saying that Sabrina, 24, that's her age, buries Corona dead. That's a little misleading. 24 dead, it sort of seems like. Situation is chaotic, it's shocking. Sabrina DeRiso, who is a member of the DeRiso family that's operated a funeral home here in Brooklyn for over 100 years, she describes that they're dealing with approximately 4 times the number of deaths that they normally deal with. I think the article says it's something on the order of 200 people die per day, and that describes that many more are. I mean, we're hearing all kinds of numbers. People are sending me a lot of articles about the Samaritan's Purse triage hospital there in Central Park, where Charles and I were on Sunday. I think I'm close to the DeRiso Funeral Home here. I really don't know this neighborhood at all. But Charles and I were there on Sunday, and I don't know very much about Samaritan's Purse. Some people don't like them and have made various allegations. I did find Melissa to be a lot less friendly and a lot less forthcoming than she was the first time we spoke to her. She seemed to want me to kind of F.O., as it were. which, that has a different meaning depending on who is saying it and as to who it's being said. So this church right here, where is the DeRiso Funeral Home? I was pretty close to it, I thought. But, we heard people are going to have to go back to the video. Did I go walk the wrong way here? Yes, it looks like I'm walking the wrong way. People are going to have to go back to the video, but I recall Melissa telling us that they had something like 40 patients in that triage hospital. What's that? Thanks. Yeah. Let me ask you this. Where's the DeRiso Funeral Home? You live in this neighborhood?
I saw it. It's past that way. It's got like a right over.
Is it super busy? Did you?
I couldn't tell you.
Do you live in this neighborhood?
The awning is over the street. It's like you'll see. It's about maybe 5-10 blocks out.
Thanks. See, people in New York are actually nice. It's people who come to New York and think you need to be not nice, like that Marine over on Pier 90. That guy's a disgrace to the Marines. I hope he sees all these videos and that he's reprimanded, not wearing his PPE properly and not speaking courteously or with courtesy to a civilian. Anyway, I'm losing my train of thought here. All right, it's right down here, the DeRiso Funeral Home. It gets nuts when you leave Manhattan because we got a 53rd Street here, there's 53rd Street in Manhattan. I can definitely understand people coming to New York and being confused. But what I was getting at is the Samaritan's Purse Hospital. I thought Melissa said there were 40 patients that had been in there, or somebody said there were 40 patients that had been in there. Now somebody sent me an article where Mr. Graham, who is in charge of that thing, says that they had 151. That sounds like a lot more than 40, but I don't know, we can't seem to get a straight story on that. Got a line around the corner there for, I guess, the check cashing place. I don't want to photograph those guys, they might get irritated. But so we'll check out this DeRiso Funeral Home. Let's see what people are saying in the comments. Surprised that some ordinary non-government people have been lying about this. I'm glad you brought that up. There's a lot of people who are lying about this because they're social engineers. Now, there's a limited number of people who are getting sort of annoyed that I use that term, social engineers. Well, it's a very accurate term. I mean, if it confuses you or bothers you, you can just substitute the word liar anytime I say that. But a social engineer is actually somebody who wants to psychologically manipulate you to cause you to do something against your best interest, like perhaps convince you that there's a deadly, highly contagious virus going around everywhere, and that if you leave your house, you run the risk of getting sick and dying. So you better close your business, stay home, don't talk to anybody, don't look at anything, don't ask any questions, just send $2.2 trillion so we can roll up a boat and do all kinds of stuff. Andrew Cuomo, let's talk about his press conference and his Orwellian statement. What he said, some people are going to say, ooh, Jason, clickbait. He didn't say we control the virus. People are going to think I meant that Andrew Cuomo put out the virus. No. He said this morning, we control the virus. It doesn't control us. This idiotic man says this at the same time that we're all locked inside our houses, closed businesses. The cops can arrest you for standing 6 feet away from somebody if they want to. I don't know if it's even legal for me to travel to New Jersey right now without being locked in a room for 14 days. So how is that we controlling the virus? Now, here we are at the DeRiso Funeral Home, and I want to make sure that people understand, I am not accusing the fine people who run this DeRiso Funeral Home of any wrongdoing whatsoever. This looks like a possible service entrance to the building. But we saw this article just the other day, said it was, mad crazy, 4 times the normal number of dead people. So yeah, I guess we're after hours. I got here a lot later than I wanted to. After hour services, please call. When I looked online, it said that this thing was open 24 hours, which seemed weird. I guess that was probably, to receive the deceased. Ooh, it's got a bit of a, Well, I don't know. I mean, okay, so here's a car that says funeral on it. So that might be owned by the DeRiso Funeral Home. I don't know. Would you be closed at 5:25 if it was this, massive, crazy crush of dead people? Excuse me. Do you guys know anything about this DeRiso Funeral Home? Do you live in the neighborhood? Don't know? Don't speak English? Okay, no problem. Thanks. We're very close to Maimonides Hospital right now. Now, okay, here, this looks like nails. See, where are they loading all these huge number of people into the DeRiso Funeral Home? People are going to say this proves nothing. Dead people are inside. I gotta say, I just find it strange that a business would be closed at 5:26 p.m. and no sign of any activity around it. We don't see anybody working there, packing their car, leaving, moving around inside there. I may call them tomorrow and ask them to comment, but I don't see a lot of activity here. I don't see freezer trucks here loaded up with dead people and coroners working overtime. This funeral home very likely is doing work with the Greenwood Cemetery. That's very close to here. Do you live in this neighborhood? Do you speak English?
A little bit.
Do you know anything about this DeRiso Funeral Home?
No, my friend.
Okay, no problem. Thanks. Yeah, not too many people are going to be familiar with the funeral home. I mean, I presume it's the type of business that's just been here for 100 years. There can't be a lot of competition in the funeral home business, right? I mean, it's not the type of thing that people are like rushing into that business. It's not as competitive as, let's say, live streaming. That's kind of a new emerging business. A lot of people are coming out all the time. Somebody mentioned before that there's a lot of people lying. Ranger 1776 says BS on steroids. Well, that's exactly right. There's a lot of social engineers, including Andrew Cuomo, who wants you to believe that lies are true. He tells you that the virus is under control, that according to him, finally hospital admissions are down in New York. We heard 4 days ago ICU admissions were down. So he's saying, well, perhaps we're over the hump. And he was very careful, much like Anthony Fauci, to say that, okay, this is because we controlled the spread of the virus. He referred back to the, let's see what that is. That's the cops. So still not a lot of sirens from ambulances, even though we're hearing that 4 times as many people are dying a day. Hi, are you with the DeRiso Funeral Home?
Yes, can I help you?
I saw an article in a Norwegian paper that was saying that there was 4 times as many people dying a day. Oh, is that Sabrina?
Yes.
Can I speak to you for a minute?
Right now.
Can I come back tomorrow?
Tomorrow after 4.
And you're from where?
I'm Jason Goodman. I've got a YouTube show called Crowdsource the Truth, and I have no issue whatsoever with the DeRiso family or the DeRiso Funeral Home. I just saw this article, and I thought you guys would be totally overwhelmed by...
We are.
Yeah. So how many funerals are you handling? Do you guys work with the Greenwood Cemetery?
Right now we have 7. We're up to 74, and that's just the ones that have case numbers.
74.
Yes.
I looked at the obituaries section. Are you guys listing the obituaries for everybody?
Not many, no, just to keep the discretion of the families.
But why do you
scheduling.
normally have the obituaries and now?
Because if a family can come from 2 to 9, they can come at any time. If the CDC is only allowing 10 people in the facility at once, that's up to the family to decide who those 10 people are at which point and who's going to step out so we can maintain 10 people in the facility at once.
Got it.
So if they have distant relatives coming at 4, then we'll tell another group of people come at 3. But that's up to them because we can't handle the scheduling on that end because it would just be...
And is it Maimonides Hospital that's bringing the deceased here, or they're coming from all
They're
over?
coming from all over.
But you guys work with Maimonides a lot, I would think. It's very close.
I mean, my Lutheran,
mainly.
Methodist.
Uh-huh. See, the thing that a lot of people are confused by is that as we go around town to the hospitals and even other funeral homes, there doesn't seem to be a lot of activity around. And we've heard that now admissions to the hospitals are down. Lots
Yeah,
of.
even nursing homes, when I call to speak to the admitting department, just because we have to get certificates online, they say we're down, and I'm like, no, we're calling from the funeral home. You need to respond to us, you know?
You mean they're down? They're not answering.
Yeah.
I'm saying the admissions to the hospital are lower, is what I mean when
The
I say
admissions
down.
are lower, but if you go around to the hospitals and you see where the trailers are that are holding the deceased, those trailers, the admissions are down now. But these people that are passing away, they've
Been admitted
there
already.
since a week or 2 weeks already. So the admissions are down, this week. But that they're not telling you what's happened prior to.
Well, they told us last week what happened prior.
they're.
So are you seeing a decline, or are you past the peak now?
I don't know. I can't even say if we're past the peak because we're still getting them by the boatloads.
Where are the boats, though? What time are the boats coming? They stop at 3?
What?
You're saying you're getting them.
Well, what we mean by boatload is we're getting
The freezer
calls
trucks.
constantly. The trucks and a lot of the hospitals, they want the deceased out, but they're limiting our availability to.
Who's
the
limiting
morgues.
your availability?
The hospitals are limiting the availability that we have to those morgues.
What do you mean? Why are they doing that?
Some of them are only opening from releasing deceased to us from the hours of 9 to 3.
So are they artificially increasing the flow? Why wouldn't they make it as easy for you as possible?
Because they don't want to bring in extra manpower.
They don't want to bring in extra manpower because it would
Right.
cost them more.
Right.
So they're allowing bodies to accumulate
And stay
to
in
save
their
money
trucks.
and stay in
Right.
these freezer trucks
But in the meantime-
rather than delivering them here. So they're artificially controlling
But
the
in
flow to you.
In the meantime, they're calling the families and harassing the families as to when are you going to come get,
What?
They're calling families, asking the families, when are you going to come have the funeral home get your loved one?
Oh my God.
You're asking the families, when are you going to come have the funeral home get your loved one? We're wanting to do our part of the job, but you're limiting us access to your morgue by either not releasing after 3 o'clock or not releasing on the weekends.
Wow. So that's unusual. They normally don't do that, right?
Right.
Why do you think they would do that?
Some of them are overwhelmed, and if you go to somebody's house, you see somebody's trucks, you wouldn't believe.
What
Yeah,
do
the
people
amount-
think about their loved ones being stacked up like bags of hay in a truck?
Most of the places are doing it with some form of respect. They're putting them on shelves, as if it's a morgue.
Right.
They're making a makeshift morgue out of these box trucks.
Wow. The public information officer for the New York City Medical Examiner's Office told me that the morgue was not overwhelmed and that these makeshift morgues, at least in the case of the one next to NYU Langone on 33rd in New York,
Right.
that was being built just as a precautionary measure, as a standard procedure because the governor had declared a state of emergency.
Then your question to him should be now.
I got a lot of questions for
If
him.
you're not overwhelmed, then why are you sending bodies out to Hart's Island to be buried in Potter's Field?
But don't they always do that? Don't they always send unclaimed bodies?
Not so fast, number one.
What do you mean?
They're usually 60 days at least before you see them packing up the truck to go to Hart's Island.
But it's usually homeless people and unknown
Correct.
identities.
But
And
now-
isn't it still that?
Now they're forcing families who might not be able to make arrangements right away to do something because those families are afraid if somebody doesn't claim my father or my mother, my father's going to be going to Potter's Field
Why would they do that?
because they're putting a fear into families.
Wow.
Not on, if that's on camera.
Okay, so
Okay.
thank you very much. Are you Mr. DeRiso?
No.
Okay, but thank you for speaking
All
to
right.
us. I appreciate it very much. Wow, a lot of information there from the employee at the DeRiso Funeral Home. I mean, I'm going to listen back to that to fully absorb what he just told us, but it sounded like he said there is some kind of manipulation of the scheduling and the release of people at hospitals. See, this is what I've been sort of interested in figuring out. Is there some manipulation going on? Because, you see, it seems like there is. When I asked Dr. Kathleen, what's her name? Dr. Colleen Smith, if she's still COVID positive, what the hospital's policy is on allowing COVID positive patients to, COVID positive staff members to see patients, she wouldn't answer that. I mean, that seems like a legitimate question to me. The New York Times tweets out that a doctor is COVID positive. That's a very serious situation. We could be losing a qualified doctor. We should be worried about her health. And we should also be worried if Elmhurst Hospital continues to allow staff members who are COVID positive to interface with patients who may or may not be COVID positive, because if you're not COVID positive and you're being tested by and attended to by a doctor who is COVID positive, that would seem to increase your risk of getting it, which is probably the opposite of what you want to do in the hospital. Dr. Colleen Smith has refused to answer that. She's refused to answer if she's ever met or interacted with Bernadine Dorn, who's an alumni of the University of Chicago. And she doesn't want to answer that. She doesn't want to answer if she's ever interacted with Michelle Obama, who was the associate dean from 1996 to 2009, during the time the doctor did her undergraduate work at the University of Chicago. I'd like to know the answers to those questions. Of course, she doesn't have to answer them. There's nothing compelling her to answer. But, you know, I think the question about her COVID-19 health status is relevant to the public and to people who might go to that hospital. It's also interesting that she knows Dr. Cameron Kyle Seidel, another social media sensation who came out of nowhere and started doing videos that are getting 100,000 views and all kinds of things. That's possible that he could be the right guy talking about the right subject at the right moment, that people are watching those videos like crazy. I mean, in general, I think it takes a long time to build up an audience of 100,000 views on a YouTube channel and on a YouTube video. It's pretty unusual that somebody would just pop out of nowhere and do that. It strikes me as the type of thing that social engineers have done in the past, you know. People might go back to the videos on Crowdsource the Truth where I was talking with Field McConnell and also Quinn Michaels. Those are two videos that got to 250,000 views very quickly. And long after I stopped dealing with those guys, it occurred to me that wouldn't it be interesting if social engineers artificially pumped up the views on those videos to cause me at that time to believe, hey, these guys are great guests. People really want to see them. Let me bring them back. Let me trust them. Let me start interacting with them. They approach me as friends. They gain my trust. We do a bunch of shows together. And then they turn on me. And they say, oh, I'm a Crowdsource the Truth whistleblower. I was on the inside. Here's the truth about Jason, or Crowdsource the Truth, or whatever. Same thing with Susan Holmes. Just the other day, the brother of George Webb, a definite social engineer, who now apparently is friends with Paul Cottrell, the quack doctor who wants everybody to freak out and who insists that there's going to be hundreds of thousands of deaths. He keeps referring back to the CDC numbers, the WHO numbers. He expressed shock that I would question Dr. Tedros Adhanom, the highly corrupt, really sinister head of the WHO, the guy who used his political influence to deny funds, food, and medicine to his political opposition, the ethnic majority there in Ethiopia. This is a terrible guy who needs to be investigated immediately. The entire WHO, yeah, defunding it, that goes without question, but it needs to be invested as a criminal organization, and I think that Bill Gates should be investigated. And I think that should be done immediately. So I don't want to give too much air to liars like Paul Cottrell and George Webb, but I do want people to understand what's going on with social engineers. I'm not here to tell anybody to trust me, trust what I'm saying. I know everything. You can decide if you trust me or not. It doesn't much matter to me. I just want you to look at the things that I'm observing. That was a guy from the DeRiso funeral home. Now, is that an actor? I don't know. I don't think so. I had no idea that guy would be there. That is evidence that there's activity inside the place, even when it looks like there's not activity outside the place. I thought it was amazing that he told us that the hospitals seem to be controlling the flow of patients out of there. I also want people to observe these comments, because you see, there's a lot of social engineers who come into the comments and want to try to affect your opinion, affect what you believe. They want you to not watch what I'm showing you, because it does not adhere to the story that they are trying to sell. Let's go back to Andrew Cuomo's Orwellian press conference. How is it Orwellian? Because it's doublespeak. He's saying we control the virus, it doesn't control us, but yet everybody around here has got these medical masks on. I never saw anybody in Manhattan or Brooklyn wearing one of those things before. I would see him like at the airport in Thailand and China and things like that, but I've never seen it in the United States. People are closing their businesses, the streets are dead. I think this virus is pretty well controlling us. That's as doublespeak-ish as Cuomo's comments the other day when he was telling everybody that he's staying home for his mother's health. But hello, Governor Cuomo, you were not at home when you made that comment. And your brother, who's a liar, who told everybody that it's illegal to read WikiLeaks emails, that you got to hear them from him. Well, that guy looks pretty healthy sitting in his house, doing broadcasts every day. I would think if he had this fever and potentially deadly disease, you would not be feeling well enough to appear on camera and to talk and to be joking. Guy looks fine to me. Doesn't mean he's not sick, but this is what I observed. Tom Hanks, his wife, they seem to be okay. Why do all these rich, famous people get over coronavirus right away? And then that one funeral home over there is saying that they've got 4 times the amount of people that they're normally dealing with. You know, it's interesting because if we listen to what our previous contact at the Greenwoods Cemetery said, he said that they're dealing with about 2.5 times the normal burial rate per week. Now, the cemetery is going to be getting all of the people from funeral homes around here, I would think, most. Maybe, I guess, Jewish people would go to one type of cemetery, Catholic, Christian, Muslim might go to different cemeteries. That one's the biggest one. I think it's getting the bulk. So if that place is doing 4 times the normal amount, but maybe other places around are doing less than the normal amount, perhaps they're able to create a condition where someone can go interview them and they are legitimately overwhelmed. I stress, I don't think that the DeRiso Funeral Home is doing anything other than honest business. This is part of social engineering. Remember, Bill Gates had that assistant that Charles was telling me about. What's his name? Some sort of Slavic name. He was named as the beneficiary in Jeffrey Epstein's will. And he said he was shocked that he was not close with Jeffrey Epstein and had no idea that he would be named as the beneficiary to this multi-million-dollar estate. And everyone right away assumes the guy is lying. He must know Jeffrey Epstein. I don't assume that. I assume that that guy is part of a social engineering operation where he might be the target. For people who are new to the channel, you might not know that in 2017, George Webb, this same liar that had an interview with Paul Cottrell, also a liar, earlier today, George Webb brought me a piece of information that there was illicit radioactive material on board a ship. And he instructed me as to how myself and the audience could interactively track ships with Fleetmon and, Vessel Finder and different websites. And so, real time on the show, we were looking at this thing. It was coming into a port. And I'm not going to go into all the details, but George provided adequate information to basically raise the level of concern. I mean, if you were in an airport and you saw a duffel bag, no one around it, and you heard it ticking, you might say, well, that's a little ridiculous. There's probably a clock in there or somebody's electric toothbrush or something. But wouldn't it be remiss to not just tell airport security, hey, there's a bag over there making a weird noise and no one's been around it for a few minutes? That's enough information to alert the authorities. If the authorities decide to close the airport on the basis of their investigation of the ticking bag, does that count as a bomb hoax? I don't think so. But if someone put the bag there and put the noisemaker in it and told you, hey, maybe you should tell the cops there's a weird sound coming out of there, and that person knew there was nothing going on, they could be setting you up as the target of some problem related to the cops. And, social engineers, for 3 years since that occurred, have been spreading the false rumor and trying to sue me over incidents and circumstances surrounding that. So I want people to become very aware of social engineers. A lot of them make comments like, I don't know if it was a software failure or a deliberate bit of interference, or perhaps that Samaritan's Purse group is using a lot of radio equipment over there by the hospital because they need to do their own internet communications, and perhaps whatever it is that they're using interferes with my equipment. Because for the second time in the history of using all this stuff, it cut out in a very bizarre way right near that installation. I have no evidence that there's anybody deliberately trying to disrupt my broadcasts, so I'm not going to go to that conclusion. But what I did was I made the restored version of that broadcast available to sponsors of the show. And I did that because it took a lot of work to restore the show. It takes a lot of work and a lot of money to maintain this equipment. Part of the reason we had that failure is that I couldn't monitor the audio going out to the broadcast. I could only monitor the audio coming out of my sound mixer because I had a phone fail that morning. So, I mean, there's a very limited number of people who don't appreciate the hard work that goes into doing this show, who send crappy comments. They never send private emails because they want all of you to see the comment, because that's part of the social engineering. They say things like, oh, the truth is free, Jason's just doing this for money. I mean, please, am I running myself ragged, missing lunch, coming all the way out here to Brooklyn, hour and a half on the subway, etc., just for money? There's a lot of other ways I could make money, and if I was just interested in money, there would definitely be other things that I'm doing. But I think most people recognize that we all create businesses and take jobs and do work to earn money. And although the truth certainly is free, it's not going to show up in your living room if you're just sitting there. And it's going to cost more than the $2 a month you'd pay to become a sponsor at subscribestar.com/crowdsourcethetruth or patreon.com/crowdsourcethetruth to come over here to Brooklyn and find it. So if you watch the show, if you enjoy the show, if you're informed by it, if you're entertained by it, if you appreciate the work, please become a sponsor. And I also want to say this. I got a message from someone who sometimes is a friend, sometimes I don't know, who told me that someone who, what was the term that he used? Not a clairvoyant, someone who does like visions, I forget the term, remote viewing. Through a remote view, this person had predicted that I would be violently attacked sometime this week. Now, I don't know if that is going to happen or not. I don't know if that was a friendly warning or if that was a threat, but this is a person who has historically been in communication with George Webb's brother, David George Swigert, an individual who has spread and continues to spread numerous malicious lies about me. So if anything happens to me this week, I hope people will keep an eye on that guy. Thanks for watching, everybody. Have a great day. Oh, and don't miss tonight's episode of More Pain, sponsor-exclusive show with Mike Moore, editor of True Pundit. That's going to be coming on at 8 o'clock. If the subways can get me back in time, get onto patreon.com/crowdsourcethetruth, subscribestar.com/crowdsourcethetruth, and patreon.com/truepundit. See you for More Pain. Thanks for watching, everybody.